Hey, it's Dr. Cruz, and today we have a ganglion cyst, most likely. I'm going to send it off our path to make sure it is what it is, or I'll just verify with your dermatology office. But most likely it's a ganglion cyst. And you can see it right on the fourth digit here. This is the third time getting removed. Not by us, so this is our first whack at it, but 2 times it was attempted to be removed, and it was, and then it would come back after 6 months or so. So we are going to basically do the same thing, but hopefully better. At least that's my plan. So the idea is I'm going to go in there and dissect with a blade, and then find the stalk, because usually in a ganglion cyst there's a stalk that goes into the joint space, and you got to get rid of that stalk, otherwise it doesn't go away. It comes back. So I'm going to go right down the middle. I know you can't see, and I don't really care because I have to do my job. So I'm going to do it. There. All right. No pain. I'm assuming you would say something if you hurt.
Oh, yeah.
Yeah, okay. You never know. Some patients just hold on. Oh, there it is. So you're going to see that. So that's already done. So I'm going to just take that all out. And I'm going to keep going because we have to. Again, I'm trying to make the smallest incision as possible because really you don't really want to make these incisions big. There's no point other than trying to get to where you need to go. Yes, I'm going to have blood in it because I didn't lift the foot up above the level of the heart before I put the tourniquet on. So there is blood in there from before the tourniquet was inflated, or placed, I should say. There you go. Good. So you can see I'm just dissecting out so that I can make sure that we get the whole darn thing. And it's in the middle. I know you can't tell right now what I'm doing, but right in the middle there is the cyst, because we know that's where it was. So I'm trying to separate the normal tissue from the abnormal tissue so that I can remove it in its entirety and also identify the abnormal stalk that's going into the joint space. And you just take your time. I know this is very exciting, but this is a necessary step, otherwise you can't see anything. And I'm trying to go right above the cyst so that I don't dissect too much. Again, minimal surgery, minimal dissection, minimal pain, minimal swelling. That is the idea here. I'm going to have you pause so you guys can't appreciate this, but this is like the perfect tool to have, because now I can just gently tease away the tissue from the actual skin. And then maybe you'll be able to see it from this angle, but I'm tenting the skin up, and then I'm going underneath and separating the cyst from the skin. Does that make sense? I think so. Okay. Uh-oh, I'm busy. There we go. Okay, so I think that's enough. And now I have to grab the cyst and kind of try to separate it. And that I'm going to do with a blade. There. So I'm grabbing. Oh, that doesn't really grab. Apparently we have cheap hemostats. Hey, I don't sugarcoat anything, okay? If they were good, they would grab. That one grabs, so I'm going to stick with the forceps. So again, the idea is I'm just teasing the cyst away, if I can hold on to it, gently.
can see it. Okay, so then I'm going to attack it from this side. So you have to be careful because there's a tendon there. You don't want to cut the tendon because he doesn't have a problem with his tendon. It's coming. I deflated the sac so you can't really appreciate the balloon that it was in, or the balloon-like structure that was there, but well, you saw the gel come out of it. You're going to be able to appreciate it when I take it out. Okay, it's out, but I still have to do detail work on it. So you can tell it's not just like a piece of skin that I cut out. It's actually a gelatinous sac, if you will. You can kind of see how it has some sac to it still, but now I have to identify the root of the problem, which looks like there's some over here too. So I'm going to remove that as well. Almost answer. So I can see the anatomy. So you can see lack of cyst, right? With that white capsule there. And it looks pretty pristine, if you ask me. It looks pretty darn good. Of course, this is probably what they said the 2 previous times too. So then my next step is I'm going to inject this area of the joint with some dexamethasone, just straight. I'm just teasing this away just for completeness sake. But that's a pretty clear picture. You don't get more clean than that. I don't know why they went to the nail the other time. That's interesting. Right, and of course they're not going to feel it because I should have anticipated that. There we go, and the joint, and a level injection. You can't see this, but I can feel the toe straightening out because of the amount of fluid going into the joint. I'm not putting a lot, but I'm just slowly pushing. Since the patient's completely anesthetized, it doesn't matter. He doesn't feel that, so it's always a relief. All right, double check. Always check your work. Again, I'm being extra detailed here, if you will. I don't know, extra paranoid, how about that? So that he doesn't have to go under this again. Because honestly, he'll probably just say, take the toe, right? If this comes back, take the toe. I don't care anymore. No, that looks good. See, all this is clean tissue. That's normal anatomy right there. I'm gonna leave that. There is no cyst. And I injected right in there where the joint space was and where the stock was. So right in there as well. All right, guys, I think that's it. So now I'm gonna suture him up and then he's gonna have a very pleasant day. You're gonna have minimal pain for the first 4 to 6 hours because it's numb. And then
well, you can kind of expect the same type of pain you had last time, okay? The only things you have to look out for is, God forbid, any kind of infection. So if any redness appears or increased pain, increased swelling, things like that, that's what you need to kind of call me about. And I'll give you my cell, so you just call me directly. I'm gonna do one horizontal stitch and then be done with it. So yeah, this was a ganglion cyst removal. To the best of my knowledge of being a foot expert, I removed the whole thing. And then of course we took the extra precaution of injecting the joint where the ganglion was stemming from with dexamethasone, an anti-inflammatory as well. But again, I identified where the root was going in, and that's pretty much what you do. So if this comes back, I'm gonna quit my job and say I'm a failure as a podiatrist, and the patient will either come back and see me or see somebody else. So we will see what this unfolds in 6 months. Well, yeah, this is not that great of a